Good afternoon, everyone, and welcome back. We were not able to hold our media briefing yesterday because the Board of Supervisors had our first of two hearings on our budget, and we will have another budget hearing tomorrow night at 5:30, and I'll give some more information about how people can get involved at the conclusion of our media briefing today. Because of that session yesterday, this week we're going to be holding the briefing today, and then our next one will be on Thursday, not on Wednesday, because of the budget hearings that'll take place tomorrow afternoon. We have a lot to go over today, but before we get to the updates on our numbers, I wanted to share some good news with you. Last week, our Board of Supervisors approved expanding our popular Great Plates Delivered program, which provides meals to seniors who are more vulnerable to the disease if they risk going out to eat or purchase food. Following federal guidelines, the program is intended to fill a gap and serve those seniors who are not currently receiving or eligible for any other federal nutrition benefits, such as CalFresh or the Senior Nutrition Program. But not only does this program help seniors, it helps about 31 local restaurants who are getting paid to cook and provide these meals. Since we started this program in May, it has become so successful that it has been extended 3 different times and is currently scheduled to run through September 9th. Currently, the program provides 3 nutritious meals a day to over 2,000 eligible homebound seniors. Our Board of Supervisors voted last week to take the Great Plates program to a new level and create version 2.0. You could say we're going back for seconds. The new program will add more restaurants and increase the number of people served to include adults with disabilities. This will be a great help for vulnerable members of our community as well as local businesses, and we are proud to be able to continue and expand it. Our Aging and Independent Services staff is recruiting new restaurants and getting ready to open up enrollment for Great Plates 2.0 in a couple of weeks. We'll announce more information then. Now let's move on to our updates, starting with Supervisor Fletcher.
Chairman Cox, and good afternoon. I wanted to update one issue real quick that's been top of mind a little bit, and that's the delays that the state has had in processing and reporting some of their returns on commercial laboratory tests that have been done. We believe the overwhelming and vast majority have now been received by us, primarily through the weekend. If you look at the testing numbers over the weekend, you'll see the corresponding asterisk to represent a significant jump, which we believe is the backlog of those state tests. A few more may trickle in, but we believe the majority of them have been done, and we certainly hope that these issues have been resolved moving forward so we can get timely and accurate data. The second thing surrounds the issue of enforcement. Obviously, it's been a source of great frustration to many of us. The public health orders are put in place out of a desire and attempt to slow the spread of the virus, to protect life, but also out of a desire to get us to the rate, case counts, percentages we need to be to have as many of our businesses open, to have our schools with the opportunity to open. And so the public health orders that are put in place are designed to protect our economy and protect our ability to move forward. Those entities, and again, we're talking about a small fraction of the total. The vast majority of businesses and entities out there are doing everything that we ask of them, and they're really doing incredible work to find creative ways to operate consistent with the public health order in a safe manner. And to the overwhelming majority, we say thank you. But we have and continue to see a handful of bad faith actors whose selfish defiance of the public health order only serves to punish those entities that are following the rules and doing everything right, and only serves to have the potential to set our region back in terms of our ability to get more entities open and to move forward as a region. And so we've been working hard to try and increase our ability to respond to these egregious, willful, blatant violators. These are the actions we've taken recently as a county to increase our staffing and public health code compliance type folks who can go out to these sites and work. But in reality, for this to happen, it is a partnership with each of the 18 incorporated cities. And we work with each of these cities, and we work with the law enforcement entities that have the jurisdiction and authority in each of these entities. There are some tools that the county can do or the county can do in coordination with code compliance folks in the cities. Those tools are a visit to talk to that entity and see if they will voluntarily come into compliance. That is a tool available. Another tool is the county can draft and issue and serve a cease and desist order, or the county can issue and draft and serve, often in coordination with law enforcement, a public health closure notice. Beyond that, there is a tool for citations for violating the public health order that has a $1,000 fine. But only the law enforcement agency that is responsible for that specific location has the ability to issue those citations. And so those 4 tools, a site visit to try and gain compliance, a cease and desist order prepared by the county, a public health closure notice prepared by the county, or a citation which will be served by the law enforcement entity that is the geographic responsibility for that area. Those are the tools that we have. And we are working collaboratively with cities to figure out the most appropriate utilization of those tools. This morning, Supervisor Cox and I joined Mayor Faulkner and the San Diego Police Department Police Chief to talk about the approach in the city of San Diego. And the mayor and the police chief made clear that for those entities that defy a public health closure notice, they will issue citations. I know one that has been top of mind recently is a gym in Boulevard. They were served a cease and desist order. They were served a closure notice. They continue to remain open. Today, the San Diego Police Department went out there and cited them for violation of the public health order. After the citation is issued, then we are either dependent upon the district attorney or, in the cases of entities within the city of San Diego, the San Diego city attorney to charge those entities. We've seen the DA do this on occasion, and we've been in communication and coordination with the city attorney's office about doing the same. And so we will continue to work to use every enforcement tool and mechanism we have, working with the cities, because we have to do that, to try and gain compliance for those entities that are egregiously, blatantly, and willfully violating the public health orders. And this is not out of a desire to be punitive, but out of a realization that for our region to get where we need to get, we have to have widespread compliance with the public health orders. And that's what will allow businesses to open, potentially schools to get back up and running, and allow our region to move forward. And so we will continue our efforts around increasing the speed at which we're able to gain compliance, and continue to work on our processes on enforcement with all the cities. With that, let's jump into our numbers for today. Today we're reporting a 7-day average of daily tests at 8,362. Again, well in excess of our goal of 6,740. Probably a little bit higher from the weekend, the significant number of state test results that lagged that came in. Our 14-day average percentage of positive is 4.8%. Again, let's go back to the previous one. Again, the 4.8% is generally trending in the right direction. That's beginning to come down. We saw that go up significantly. It is coming down, and so that is encouraging. You see our total tests there at 683,000. Our 7-day average of investigations initiated within 24 hours is now where we want it to be, 97%. Again, it was not that long ago. That was in the single digits. We moved, made adjustments, brought in more people, and have that in the range of where we want it to be, along with our 7-day average of close contacts being tracked, being right at our goal for where we want to be. And then you see the treatment numbers on the right-hand side. Moving to today's totals, this is the first day in quite a while. We're reporting under 200 cases, 182 positive cases being reported today. And out of the 5,669 total, a 3% percentage of positive. Again, we're looking for trends over time and not individual days. We're going to see day-to-day fluctuations, but in general, things are heading in a positive direction. We want to continue to see them move there, but we are doing a good job in San Diego of slowing the spread and beginning to get this back under control. Likewise, our number of hospitalizations relatively flat yesterday to today, but still down compared to where we were. Slight uptick in both COVID-related ICUs and COVID-related hospitalizations, but again, down pretty significantly from where we were back in June and July in particular. We'll go to the next chart, which is our hospital census. Again, you see COVID-related numbers there, non-COVID-related numbers, 4,100, holding relatively stable and flat across the board, and still well short of the 4,890, which is a trigger for hospital system capacity. Final chart today is ICU capacity and occupancy. And again, here, relatively good. You see our COVID-related numbers, non-COVID-related numbers, and holding relatively flat there at 61, which also is good. That concludes my section of the report. I'll now turn it over to Dr. Wooten for a Public Health Officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. Today's global, national, and state statistics are based on data from the Johns Hopkins dashboard, and the data were attained today at noon. We've reached milestones for global and national cases. Globally, there are over 20 million cases, and nationally, there are over 5 million cases, which is 25% of the global count. Today's local statistics in San Diego County are from reports as of 11:59 yesterday. Today, there is a total of 33,157 cases, which is 182 more cases than yesterday, a decrease in new cases since yesterday's report of 228 cases. And I'd just like to acknowledge the fact that the last time daily cases were below 200 was on June 22nd, with 198 new cases reported. The overall total number of cases includes 602 deaths, 8 new deaths reported since yesterday. The age range is unchanged, 3 months of age to 102 years of age. The age group 20 to 49 years of age also remains at 59%, which is 19,525 cases. Gender is still broken out by 51% female and 49% male, with 114 individuals not having gender information provided. And 2,771, or 8%, which has slightly decreased, of cases have been hospitalized. And of the hospitalized number, 694 have been admitted to the ICU. This number is 2% of the total number of cases and 25% of the total number of those hospitalized. Now, this next slide reviews COVID-19 demographics related to hospitalized cases. Of the 2,771 hospitalizations, the 50 and over age group represents the majority of these cases, which is 1,960, or 71%. Males represent the majority at 1,507, or 54%. Hispanics or Latinos represent the majority at 1,582 cases, or 61%. In this next slide, the total number of deaths, which is 602, represents 2% of the total number of cases. Of the deaths, 258, or 43%, were female, 344, or 57%, were male, 576, or 96% of all deaths had underlying medical conditions, and 26, or 4%, did not have underlying medical conditions. The county wishes to extend its sincerest sympathies and condolences to the family and friends of the people who have died from COVID-19, and particularly of those deaths that we announced today. Next, I would like to bring attention to the summary of all outbreaks. Since the beginning of the pandemic, 336 total outbreaks have occurred in 3 primary categories: skilled nursing facilities, other congregate settings, and community settings. Community settings is one of our county's 13 triggers, which we will discuss in more detail shortly. Of the 336 outbreaks, 208, or 62%, are now closed and inactive, meaning that there have been no new cases in the past 14 days or longer. This leaves 128, or 38%, of the 336 outbreaks that are now active outbreaks. And of these, 31%, or 36%, are in our skilled nursing facilities, and there are 86 of these in San Diego County. In total, there have been 775 residents and 496 staffs with laboratory-confirmed COVID-19, including 146 deaths. 30, or 23%, of the 128 active outbreaks are in non-skilled nursing facilities or other congregate settings. In this category, there have been 697 residents and 544 staffs reported, which includes 95 deaths. 67, or 52%, of the 128 active outbreaks are in community setting locations. Since March, the total number of outbreaks have produced 1,366 laboratory-confirmed cases, including a total of 11 deaths. Now, before diving into our discussion on the triggers, I want to take a minute to address the discrepancies in state data reported last week. I'm happy to report that at this stage, the issue has been resolved and no further significant impact on San Diego County data is expected from this point forward, but we will stay tuned. Next, I will review the 13 triggers for San Diego County as is provided on this table. These triggers help to determine what actions would be taken in modifying health officers' orders, and as you know, the governor imposed restrictions moving indoor business operations to outdoors in mid-July. San Diego County has currently only one of the state's metrics that is abnormal and in their list, and that is our county trigger number 1. Trigger number 1 is related to case rate, a state metric, again, that has the county on the state's county monitoring list. This trigger reflects the rate of cases per 100,000 population for a 14-day period, measured using the date of illness onset with a 3-day lag. Currently, the case rate is 101.2 based on county calculations and 105.3 based on the state's calculation. And the question I know that people consistently ask is, why are those two numbers different? We calculate our numbers based on all cases that have been reported through 11:59 the prior day. The state may calculate theirs based on the time that they create this rate. So if any additional cases have been reported to them during the day, they use that information. And also, the state has removed inmates or individuals from correctional facilities from their list. Now, for the past 2 weeks, the case rate continues to decrease, and we are very happy about that because it is moving in the right downward direction. These results are indeed promising, and I am thankful to everyone for doing their part to help change this metric. San Diego County continues to keep up the great work by businesses and individuals adhering to the best practices that we continue to share with you every briefing. It is important to emphasize that when we come off the state's monitoring list, the only sector that will be allowed to reopen is schools. So I just wanted to make sure that people are aware of that. The state currently allows for waivers for elementary schools, which the county is accepting these applications and reviewing so that we can submit to the state. Once the county is off the state's monitoring list for 3 days, then we will have to continue to show a normal case rate for an additional 14 days, and on the 15th day, grades 7 through 12 can reopen. The state will need to provide guidance on opening of other sectors, and that authority does not lie or reside with local jurisdictions. Moving on now to trigger number 2. This is related to case outbreaks. First, in the next slide, this slide shows all active and inactive community setting outbreaks since March 25th by, next slide. I think we've, by month. Note that July has the largest number of outbreaks with 93 of the 188 outbreaks. This slide shows all 188 outbreaks by community settings, and represent 1,366 cases, with the largest number of community outbreaks occurring in June and July, when, and this was after businesses and various sectors were opened up. And then in mid-July, we had the restrictive orders imposed by the governor, and that resulted in the decreased number of cases that we have reported over the past week and specifically today. Now, in the next slide, the top 3 settings include 50 outbreaks in restaurants slash bars and 11 in restaurants. So those are grouped together, 45 in various businesses, and 18 in healthcare settings. And this, again, is the total number of settings for community outbreaks since the beginning of March. In the next slide, it shows the outbreaks reported over the past 7 days. Today, we are reporting 29 total community outbreaks for the past 7 days. 6 new community outbreaks were added today in the next slide. And you see them here as 2 in businesses, 2 in government, 1 in restaurants slash bars, and then 1 in a gym. The next slide shows the community setting for all of the 29 outbreaks in the past 7 days, as is provided on this slide. Now, on the next slide, the number of COVID-19 outbreaks in community settings continue to occur throughout the region, and again has almost doubled for the months from June to the month of July. And again, in mid-June, businesses were opened up, and then in mid-July, we had to restrict and dial back. And we just wanted to show the stratification of the various settings for the outbreaks during these 2 months. Lastly, this slide is just a table of that same information, just a different visualization, if this may work better for some people that are reviewing these data. Now, the last trigger is number 11. It is now normal, which was previously abnormal, as you can see by the line here, and it has normalized due to the increase in the number of case investigators that have been hired by the County of San Diego. We are now at 97% for the past 2 days, today and yesterday. And we are very happy that we have resumed normalization of this particular metric. This helps to quickly identify and interview cases so that we can identify close contacts. In closing, getting through this pandemic requires that we all do our part, and the majority of San Diegans are doing just that. Kudos go out to those businesses that have been responsive and innovative to implement the state's order to conduct business operations outdoors. Continuing these efforts will require that everyone adheres to the following: washing your hands and promoting sanitation practices, staying 6 feet apart from others unless it is your household member, wearing a face covering when you go out, avoiding crowds, and staying home if you are sick. Now, please welcome back to the podium Chairman Greg Cox. Thank you so much.
Thank you, Dr. Wooten. We'll go directly to the questions.
San Diego Union Tribune, please state your question.
Hi. You talked about working with the city of San Diego to increase citations for egregious violations of the public health order. When do you anticipate you will have the same type of cooperation from the other law enforcement jurisdictions in the county?
I'm going to have Supervisor Fletcher respond to that.
Thank you, Paul. Obviously, the city has clarified that they will be doing that. Sheriff Gore has clarified the same. And again, we'll continue to work with each jurisdiction. When we find those entities, it is a rare occasion that after being served with a public health closure notice that they don't close. In most every instance, either a cease and desist, either a visit, a cease and desist order, or a public health notice have been sufficient to gain compliance. What we're really looking at is those folks who at that point continue to do it. I think what we want to do is be able to move more swiftly in getting out to those entities, assessing what's going on and preparing the proper public health notices. But thus far, we think most law enforcement in that instance, should it occur, will be willing to issue citations. And again, the DA has been willing to charge those citations, and we've gotten indications from the city attorney they will be as well. So we're hopeful that we can increase the speed at which we can tackle the egregious violators.
And to be clear, the fine is $1,000 per day, right?
That is correct.
Thank you.
Yep, thanks, Paul.
Okay, next question.
Alexis Rivas with NBC7, please state your question.
Hi, good afternoon, everyone. It seems like we're moving in the right direction with a lot of these numbers. And given that, I'm curious to know, how close do you think San Diego County is to getting off that watch list?
I'm going to let Dr. Wooten bring out her crystal ball and try to respond to that.
Thank you so much for that question. As you can see, based on today's results, we are very close. And we just have to continue to monitor it and do the daily calculations. If our numbers of new cases on a daily basis continue to be less than 200, we should be, at least we should be below 100 per 100,000 population very soon. I'm not going to throw out a time period because I don't have the crystal ball to do that. So it depends upon the number of daily new cases that we get. As I stated today, we were less than 200, and this is the first time we've been less than 200 or had less than 200 cases reported since June 22nd. So everything is positive and moving in the right direction, and we hope that we will be off the monitoring list soon. But being off the monitoring list doesn't mean that things open up. The only thing that will open up if we come off the monitoring list, we have to be off for 3 days, and then after that 3-day period, we have to be off for another 14 days, and on the 15th day, schools, grades 7 through 12 can open. And I say grades 7 through 12 because right now we are accepting applications for waivers for elementary schools to be open, and they can be open in the face of us being on the monitoring list. That's why it is a waiver. But for those other schools that don't submit applications, if what I've just shared with you, 3 days off the list, then another 14 days, then all schools K through 12 would be allowed to open. Thank you.
Oh, I'm sorry. If I could I just want to confirm the number of new cases since yesterday, because I think I must have logged it incorrectly.
I'm sorry, what was the question?
If you could just repeat the exact number of new cases that we had today. You said it was the first time it's been below 200 since June 22nd, but exactly what was the number of new cases?
Today, we reported 182 new cases.
Got it. Thank you so much.
Mm-hmm.
Okay, let's go to the next question.
Jeff McAdam from Fox 5, please state your question.
Hi, good afternoon. Yeah, I had just wondered, I'm on a story today with the people in Ocean Beach over the drum circle that they have out here every Wednesday night. I know that there are businesses that have been issued citations for violating the public health order, but we've seen very little enforcement of individuals who are not practicing social distancing or wearing masks. At one point, San Diego police had gone over a month without issuing a ticket. I wonder if you guys find it difficult for people to respect a public health order when there's no enforcement, and if so, how does that change, and do you anticipate change within law enforcement here in the weeks to come?
Okay, Supervisor Fletcher is going to respond.
Yeah, thank you for the question. I think it's certainly frustrating when the effort and aim and intention of the public health orders is to slow the spread so that our community can move forward with as many things open as possible. But in terms of the actual enforcement posture as it relates to individuals, we really would have to refer you to the law enforcement entities for those jurisdictions, as it is within their discretion how they choose to do it. We know what we're doing with entities, with businesses that are non-compliant. We have a plan, we have a system, we're moving forward on daily trying to make that better. But as it relates to the individuals, it really will be a jurisdiction by jurisdiction decision. I know we saw one entity in Del Mar that is expanding their law enforcement presence to have more enforcement of public health related issues. But again, that is at the discretion of each law enforcement agency in that jurisdiction.
If I can too, they had mentioned today, a representative with the city was here in Ocean Beach saying that they are working, the city is working with the county and working with law enforcement to come up with a plan here for Ocean Beach. I wondered if you guys were aware of that plan at all and could share some of the details with enforcement, if you happen to know it.
I do not.
Okay.
Thanks.
Okay, we have one final call-in question.
Derek Stahl with 10 News. Please state your question.
Yeah, Derek with ABC 10 News. So I have a question about the way that we track COVID deaths. Recently, other states like Colorado have actually changed the way they count deaths. They now differentiate deaths from COVID and deaths from another cause in an individual who happened to also test positive for COVID. So I guess my question to either Dr. Wooten or Dr. McDonald is, are we making this differentiation here? And to pick an extreme example, if somebody dies in a motorcycle crash here in San Diego County and also tests positive for COVID, do we count that as a COVID death?
Okay, Dr. Wooten's going to respond.
Thank you for that question. The short answer is and I think we've explained it numerous times about how we determine locally how we determine COVID-19 deaths. If it's on the death certificate in Part 1 or Section 1 and is cited as a contributing factor. Now, the example that you gave, it's quite possible that if someone was in a motorcycle vehicular accident and they just happened to be positive for COVID, if they were hospitalized, the COVID infection could have an impact on their recovery. So I think it's difficult to split those hairs. So if an individual, and we are asking hospitals to test their patients if they have symptoms, and also if they have symptoms and they turn out to be COVID, then they are COVID-related hospitalizations. So the easy answer is no, we are not splitting types of deaths. If it is on the death certificate, an individual has tested positive, and all of our deaths are they are confirmed or they have been tested for COVID-19. They're
Gotcha. And if I just
go on.
Oh, sorry. And if I may just follow up. So I guess some folks have expressed a concern that perhaps we are overcounting COVID deaths by not making this distinction. Do you think that there's any chance that we are overcounting COVID-19 deaths by not differentiating this?
No, sir, I do not think that.
And why?
If someone dies, if someone is sick with multiple underlying medical conditions, we know that if they have these underlying medical conditions in the face of a COVID-19 infection, they are going to have worse complications associated with their recovery, and in many cases, individuals will die. So that's why underlying medical conditions increase the complications for individuals that have COVID-19. Even if they might have a heart attack in the hospital that may not be related, or they might have been admitted for a heart attack. If they develop the symptoms and or test positive for COVID-19, that can impact the quality of their recovery.
Thank you.
Yes.
Okay, Dr. is a text question from Quinn Connold from KGTV 10 News. Can you please give an update on whether any schools have applied for waivers to reopen, and if any have been approved? And if so, can you provide the names or locations of these schools?
So right now, we are receiving applications for elementary school waivers or attestation forms that will be submitted to the state. Once they are, the review is complete, we approve them, review them, approve, and submit to the state. Once the state gives us their response back, then we will post the applications on our school sector website. But right now, we're in the process of reviewing the applications. So that is where we are.
Thank you, Dr. Wooten. This next one is from Jane Morton with CBS 8. She says, we understand a new COVID testing station is opening near the pedestrian crossing in San Ysidro tomorrow. Is that correct?
Yes.
And why was the location selected?
Well, we know that individuals in South Bay are hardest hit, and the location was selected for 3 reasons. Number one, again, increased number of cases in that region, so we are increasing testing access. Number 2, we know that individuals live in Baja California and cross the border, so also individuals that are U.S. citizens can be tested there. And then third, individuals that are essential workers that cross over into the U.S., that is an opportunity for them to be tested.
And you did address some of the cross-border traffic, but she also asks, how much of a concern is there over COVID-19 cases coming into the United States from Mexico?
Well, we know what the stats have been in Mexico, but we also know that there are several ways that people come across the border and make their way to our hospitals. The first is ambulance transports, and we know that ambulance transports actually are less if we look at last year up through March 20th, and then March 21st through August 7th. It was about 7.7% or 7.7 individuals were transported for last year before COVID. And then since COVID, it's 7.12. So the number is actually less overall in terms of transports that go to the hospital from Mexico. And we also know that since the closure of the border on March 30th, the number of individuals that are crossing over has increased. Right now, it's between 80 and 90,000 individuals cross over northward into the U.S.
Okay, thank you. We have another question from Adam Racusin from 10 News. He asks, the state had data issues and some counties are reporting case numbers that may not be 100% accurate due to duplicate testing results. How confident are you that the daily numbers you're reporting are 100% accurate? Is there a possibility they aren't, and why?
Well, I'm quite confident that our numbers are accurate because we have web CMR, and our tests are not all funneled through CalReady. Our test results are reported directly to the county. The only issue, which you already know about, is the glitch with Quest, which was going through the state and then coming to us. So we are fairly confident that our information is accurate.
Okay, one more question. Sorry, this one just came in. This is from Paul Sisson with the San Diego Union Tribune. He asks, wouldn't it take roughly 4 weeks, averaging fewer than 100 cases per 100,000 residents before grade 7 through 12 schools could reopen?
Well, it depends on when you make that calculation, Paul, and thank you for that question. Right now, we are very close to 100. 3 or 4 weeks ago when the case rate was 150, that's when the example was given that it would take 240 or less new cases a day for 14 days for us to get off the monitoring list. So again, we are very close to being off of the monitoring list, and if you could show the slide that shows the case rate, so that I anticipate that we'll be off the monitoring list unless something horribly goes wrong with the daily number of cases reported. If we continue to maintain a less than 200 number of cases per day, I anticipate that we will be off the state's monitoring list fairly soon. Once we are off, this is it right here. So we've calculated today 101.2. and the state has calculated 105. Going with the state, we are 6 points is needed for that to change to be less than 100. So once we are off, we have to be off for 3 days. If we continue to be off for 3 days, then we have to be off for another 14 days, and on the 15th day, schools can open. Thank you.
This last question deals with some of the gyms that have been in violation of our public health orders, and Supervisor Fletcher is going to respond.
This question is from Taryn Mento with KPBS. Her question is, Supervisor Fletcher says SDPD did cite a gym that long ignored county orders to close, but another operator of a gym who is abiding by the rules says customers are leaving his gym for those that are ignoring the rules and staying open. What do you say to that business owner?
No, that's the frustration with what we're doing, is it not only impacts our region and the potential for more outbreaks and spread when folks don't follow the public health orders that are designed to try and lower our case, but it also is a direct affront to all of those entities out there, the overwhelming majority, that are working so hard to operate in compliance and to do things the right way. A way that is safe for their customers, a way that is consistent with the public health orders. And that's why I'm certainly one that would like us to see much more swift action in terms of our enforcement posture against those egregious violators, because it damages the entire effort of what we're trying to do as a county, but it also really undercuts the incredible work that all of those entities that are in compliance are doing. And so I certainly understand the frustration, and we're doing everything we can to hire more people, to work more closely with law enforcement, to get them out, to work with cities and jurisdictions, to do everything we can to get folks in compliance. So it's a very frustrating situation. It's very difficult, and we're hopeful that we can gain greater compliance for our region.
Thank you.
Well, that completes our questions for today. Thank you for participating. Before we go, I wanted to let you know that we're continuing to ramp up our T3 strategy. Yesterday, on Monday, we opened a new county testing site at Cal State San Marcos in North County. As was mentioned just a few minutes ago, tomorrow we'll be opening up our latest county testing site in South County, right at the PED East border crossing location at the San Ysidro Port of Entry. This will be a pilot program that we will be evaluating, and we believe it will provide a valuable information on virus cases and essential travelers that are allowed to cross every day by the federal government. I want to thank Customs and Border Protection for their assistance with us on this site. Again, we will return to the media briefings on Thursday of this week for another update. Tomorrow night, our Board of Supervisors will hold an evening hearing on the proposed county budget for fiscal year 2021. For public health reasons, it will be a virtual meeting. You can watch online on our county social media sites, and you can comment through the county's website at sandiegocounty.gov/telecomments. Please stay safe, San Diego, and protect yourself and protect others. Thank you.